Good afternoon and welcome to Dr. Lakeisha OBGYN live stream. I'm just going to take a few minutes and let a few more people join in, but first I want to say thank you so much for liking my last two videos. Thank you for sharing my page. Thank you for the comments and the topic recommendations, and I hope that you enjoy our topic today. Again, I am Dr. Lakeisha, your board certified obstetrician gynecologist, specializing in helping women who are struggling with life, sexual dysfunction, and self-image. So today, ladies, is it hot in here? We are talking about menopause. Thank you for joining, Dr. Jared. Just take a few minutes and let a few more people join in. Thank you for joining, Charlotte. Remember, please share my video and like my video, but also like my fan page so you can keep up to date on what's going on with Dr. Lakeisha. Thank you again for joining, and I just want to send a personal thank you for so many fans liking my page and liking my last two videos. Today we are talking about menopause, and actually it is hot in here, and Mississippi is extremely hot today, but we are talking about menopause today, ladies. And at first, when I was preparing this topic for you, I realized that there is a lot of information for menopause. So I'm going to break this into two live streams. Today, I'm going to give you the secret sauce, what you really want to know, and talk about the most two common symptoms with menopause. And then next week, I give you the rest of the information. So today, let's first talk about symptoms. Well, first, let's talk about what is menopause. So first, menopause is defined as when you've gone 12 months with no menses. So once you have gone 12 months with absolutely no cycles, you are officially in menopause. The average age for menopause is about 51. However, the perimenopausal phase, the years leading up to menopause, can last anywhere from 4 to 8 years. So what are you looking at? What type of symptoms can you expect to have when you're experiencing menopause? The most two common symptoms are irregular menses and hot flashes. So first, let's talk about the bleeding, because bleeding can be different for everybody. Some women may have heavier cycles. They may last the same amount of time, just a heavier flow. Some women may have longer cycles that last 7 to 10 days. Some women may stop seeing their cycles altogether. So some women may start skipping cycles, having a cycle every 2 months, every 3 months. It just depends. So that's why we say irregular menses. We don't want to label it as heavy bleeding or no bleeding, because every woman is going to be different and their cycles are going to change when they're going through this perimenopausal phase. Number two, which is the most common symptom women have, is the hot flashes. We are talking about vasomotor symptoms that are transient, that come on and you get this extensive heat in your upper chest and face. So hot flashes. Number three, sleep disturbances. So some women will start having insomnia. Some women's sleep is disturbed because of the hot flashes, having to wake up to change your bed linens, to change clothes, because you get so soaking wet at nighttime that you have to get up, and that can disturb your sleep and make you have a very bad day. Mood swings and anxiety would be number four. Number five, which is another hot topic, is vaginal dryness. Number six, weight gain. And number seven, decreased libido. So first, let's just quickly go back over the major symptoms of menopause. Number one, irregular menses. Number two, hot flashes. Number three, sleep disturbances. Number four, mood swings and anxiety. Number five, vaginal dryness. Number six, weight gain. And number seven, decreased libido. So let's talk about hot flashes, because that's the most common symptom women talk about in clinic, and that's the most common reason why women want to start hormone replacement therapy or HRT. So hot flashes can really affect your quality of life. They can disturb your work days if you're soaking your clothes. They can interrupt your night if you're having night sweats and constantly have to change linens and clothes 2 or 3 times a night. So they can really affect your quality of life. It's not only a symptom of menopause, but it can really affect your work days and just have to make you make a whole lot of changes in your life, from the way you dress to the way you eat to how you sleep. So transient episodes of intense heat that starts in your upper chest and your face. The highest occurrence of hot flashes will be in the first 2 years of menopause or perimenopause, and they typically last 6 months to 2 years. So let's get to the nitty gritty. What can we do to fix these hot flashes? First, I'm going to talk about some non-traditional ways, because with recent studies, a lot of women are very hesitant about taking hormones. They don't want to increase risk of cancer. They don't want to be on hormones. They don't want to be on anything that has estrogen in it. So I'm going to talk about some non-traditional ways that really have been proven to work if you put the work in and you're dedicated into doing these alternative methods that require a little bit more time, a little bit more effort on your part, but it keeps you from having to take a pill. Hey Christy, thank you for joining us. Hey Dr. Dawn, thank you for joining. Please like and share my video, ladies, and also like my fan page. If you think this information that I've been doing over the past Saturdays will be helpful for friends, family, or for you, please let your friends and family know that I'll be doing this every Saturday. Women's health, the most valuable and up-to-date information. Also, this topic came from another fan, so if there's something that you want to talk about that you haven't had a chance to talk to your doctor about, leave it in the comments and I'm glad to add it to the list of upcoming topics. And we're going to continue with some non-traditional ways to treat hot flashes. So the first one is just relaxation. We're all stressful, we all live very busy lives, but when you start adding menopause and hot flashes to a very busy schedule, we forget to take care of ourselves, lady, and we forget to relax. So meditation or yoga has been proven to help with hot flashes. Any 30-minute routine that you can do to let you relax and kind of calm down from your day, or start your morning in a more relaxed atmosphere. So meditation or yoga has been proven to help with your vasomotor and hot flash symptoms. Number 2, exercise on a regular basis. Less physical activity increases your risk of hot flashes. It's been proven. Now, I know most people are thinking, if I'm going to exercise, I'm going to get hot and sweaty, but the overall effect of the exercise, the endorphins, will actually help you decrease your risk of hot flashes. The other thing is obesity, which will be a result of less activity, increases your risk of hot flashes. So exercise will give you a twofold impact. It'll help decrease your risk of hot flashes, but it also help decrease your weight gain, which will again help decrease your risk of hot flashes. Dress in layers. So women who are already menopausal know this tip works. If you are having frequent hot flashes throughout the day, you need to dress in layers so that when you have a hot flash, you can take your cardigan off, you can take your jacket off, and you're left with less thinner layers so that you can survive the episode of hot flashes, and then you can put your sweater or your cardigan back on after it passes. So keep cool and dress in layers. Next number goes back to number 2, maintain a healthy body weight. The more fat, the more adipose tissue you have, the higher your risk of having hot flashes. So again, we want to exercise on a regular basis and we want to maintain a healthy body weight. Now, everybody's body weight is going to be different, so I'm not saying model body weight. I'm just saying a healthy body weight. And that would be like a BMI that takes into consideration your height and your weight. So you want to have a healthy body weight. The next number is don't smoke. Smoking increases your risk of hot flashes. Hey Candy, thank you for joining me today. If you like this video, please share and please ask your friends to like my fan page, Dr. Lakeisha, OBGYN. Next, slow, deep breaths. So a lot of women start to experience their first set of panic attacks when they start having hot flashes because they really don't understand what's going on. It's embarrassing because it happens at just the most inopportune times. And so hot flashes also tend to lead women into having panic attacks or anxiety. So slow, deep breaths when you are in the midst of a hot flash. Step away from what you're doing so that you can be alone and take a slow, deep breath. Slow, deep breaths. And that also goes back to number 1 with meditation and yoga. So if you become an expert in meditating and yoga, then when you have an episode, you can step away and you can easily, in a very short period of time, use your meditation techniques, take slow, deep breaths, and you can manage that hot flash without medical therapy. Avoid triggers. Again, a lot of women who are currently experiencing hot flashes know that this is true as well. And there are a lot of triggers that make your hot flashes worse. Some we enjoy and some we aren't willing to give up, like alcohol. But during that 2-year phase, you may want to decrease your intake. So certain foods will trigger your hot flashes. Definitely alcohol will make your hot flashes worse. So if you could just decrease your alcohol consumption by half, especially for those of you who like to drink wine every night, or if you can cut it out completely if your hot flashes are severe, you will notice a significant difference in your hot flashes. Hot drinks and caffeine have also been shown to increase your risk of hot flashes. So that's another thing that you can do so you can stay away from using HRT or hormone replacement therapy. Emotional reactions, getting upset easily, and how you respond to situations will also increase your risk of hot flashes. So staying calm, again, meditation, yoga, slow deep breaths, staying calm helps you decrease your risk of hot flashes. Thank you, Dr. LaTanya, for joining in today. Please like and share my video, guys. Next, we're going to talk about non-prescription therapy. So, of course, we all know about over-the-counter herbal medications that you can try, black cohosh, soy foods, vitamin E, and those work. Just remember that you're doing an herbal medication, and the variations in those medications differ from brand and from bottle to bottle. When it comes to prescription medications, you also have several options, even in the hormone replacement therapy family. There are the traditional hormone replacement options, which are pills, patches, sprays, gels, but they are formulated from a company and they are certain doses that can't be changed. A new thing that is out now is called bioidentical hormones, which can be compounded specifically for the hormones that you are lacking in. Now, with bioidentical hormones, you have to be tested. You get a lot of blood work done up front. And once we find out if you're low in testosterone, if you're low in estrogen, if you're low in your progesterone, we have a pharmacy compound those hormones specifically for what you are deficient in. In addition, though, those hormones usually come in separate pills. So you may have to take 2 pills, you may have to take 1 pill, you may have to take 3 pills, as opposed to traditional hormone replacement therapy, which are combined into 1 pill, 1 patch, 1 gel, 1 cream. Also, antidepressants have been shown to help with hot flashes. And again, that is not a hormone replacement therapy, but you can still use it to help with your hot flashes. And number 2, vaginal dryness is the second most common symptom women have when they're dealing with menopause. Now, if you're having vaginal dryness but not really suffering from the hot flashes, there are therapies for you as well. One is you can simply use over-the-counter vaginal lubrication, KY jelly, Astroglide. Any of those things will help. Even if you're not sexually active but still struggling with vaginal dryness, you can use products called Refresh, which are available at Walmart, and you use them about every 3 days. And so that helps with vaginal dryness as well. However, there are hormone replacement therapies specifically designed for vaginal dryness. There are creams and pills with estrogen in them that can help you return that vaginal tissue back to a moist, pink, fluffy environment for those of you who are sexually active and still struggling with vaginal dryness. So thank you for joining me today. There are a lot of more topics that I need to discuss about hot flashes. Remember, we still need to talk about the irregular bleeding, the sleep disturbances, mood swings and anxiety, decreased libido, and the weight gain. So I will be talking about those next week on my second live stream on menopause. Again, I am Dr. Lakeisha, your board certified obstetrician gynecologist, specializing in helping women who are struggling with sexual dysfunction, self-image, and life. Yes, Dr. Jared, do you have any questions? Please like my video, share it with your friends, but also ask them to like my fan page. That's Dr. Lakeisha, OBGYN, on Facebook, Instagram, Twitter, Periscope, and LinkedIn. Any questions? For those of you just joining me, I will give a quick recap on everything we've discussed today. We were talking about menopause and is it hot in here? Specifically, the 2 most common questions. Okay, I'm going to stroll back through because I think I missed some questions. Okay, first I'm going to answer Candy's question. And yes, Candy, there is a topic called premature ovarian failure, which is pretty much like premature menopause. It can send you into menopause early. If you're having these symptoms, you can have blood work done to test your FSH level, your estradiol level, and see where you are on your hormone levels, because you can have early menopause. Typically, menopause depends on the average age of 51, but it can also be based on your family history. In addition, menopause can be early because of medications that you're on. Sometimes medications can make you have symptoms of menopause, like hot flashes, vaginal dryness. Sometimes even birth control pills can make you have a decreased sex drive and vaginal dryness. And so sometimes those need to be changed as well. Another culprit is sometimes antipsychotics. depression medications, medications for bipolar. Sometimes these will have side effects that make you have some of these symptoms of hot flashes. So even if you're not 51, if you're in your 20s or 30s and you're struggling with, decreased sex drive, hot flashes, or any of these symptoms that I mentioned earlier, you can see your primary care physician or your OBGYN, and you can be evaluated for premature ovarian failure or early menopause. I'm going to scroll and look for some more questions. Charlotte said that caffeine and sweets make her hot flashes worse. Yes, I did mention caffeine in one of the topics, but I forgot to mention sweets. Sweets can also make your hot flashes worse, but we really don't know every food. But sometimes I tell patients to keep a journal because everybody's going to be patient specific. So if you're eating something that you love and it's a big part of your diet, but it makes your hot flashes worse, then you may want to cut it out until you pass the perimenopausal menopause phase. So we didn't list every single food. Lots of foods and things in your diets can make your hot flashes worse. If you can't identify the item, sometimes I ask patients to keep a journal and just keep up with what you're eating, and then correlate that to how bad your hot flashes were the day you had, based on what you had in your diet that day. Thank you, Charlotte. Yes, Dr. Don, there are lots of medications that can decrease hot flashes. A lot of people like to start with herbals, just over the counter, like black cohosh or vitamin E or soy foods. But when it comes to prescription medications, the realm of hormone replacement therapy is large. There are tons of pills and patches and creams and sprays, anything you possibly think of, injections, hormone pellets. So it's just patient specific. But if you don't want to take a pill every day and you're looking for something easy, the most innovative medicine technology out now is testosterone pellets. For women, you can get those every 3 months to help with hot flashes and menopausal symptoms. They work excellent. Just 4 office visits a year, so you don't have to worry about taking a pill every day. And they help with weight gain, balance, decreased libido, and vaginal dryness. So that is the newest technology for hormone replacement therapy. But in addition, some antipsychotics or antidepressants have been shown to help with vasomotor symptoms to decrease them by 40%. So for those women who have had a history of breast cancer or any GYN cancer, and your doctor has told you that you are not a candidate for hormone replacement therapy, there are still options available for you that you can discuss with your primary care doctor or your physician. So again, antidepressants, specifically like Effexor, has been shown in studies to decrease hot flashes by 40%. And yes, Dr. Jared Primrose has been shown to help decrease hot flashes as well. Candy, when you see your obstetrician gynecologist, let them know what type of symptoms you're having specifically, because it may be your medications. So first I would say is just tell them the symptoms that you're having. Don't ask for blood tests, because then they'll think you're trying to use Dr. Google to tell them how to do their job. So what I recommend is just say, can I have a conversation with you? I've been dealing with some things that I'm really concerned about, and then give them your symptoms and try to make a whole list of your symptoms. So if you're having trouble with your cycles, because it could be an adnexal mass, you could have a ovarian mass that's secreting some abnormal hormones. So you don't want your doctor to overlook a problem that you may be having, trying to please you and specifically jump into certain tests. So I would say have a very candid conversation about all your symptoms, get a very full physical exam to make sure it's not something else. And then if you truly end up being in early menopause, I would recommend trying hormone replacement therapy. Yes, Paula, some birth control pills, and everybody's different, so everybody responds to medications differently. But I have had a lot of patients who notice decreased sex drive specifically depending on the type of birth control pills that they've been taking. So I've had to adjust patients' birth control pills because of that very one specific complaint. And so everybody responds to hormone replacement therapy and birth control pills differently, which is why you have to follow up with your doctor. Don't just stop taking your medications just because you feel like it's not working. Go back and say, hey, I like that it did this, this, and this, but I really feel like I had the side effect of A, B, and C. Is there another option for me? And there are lots of medications on the market, so we can always try something different. Guys, thank you so much. Coco Jackson, thank you for liking my video and sharing it. For all of you all who have liked my video today and shared it with your friends and family, I really appreciate it. I'm trying to give you the most up-to-date information in women's health. I will be here every Saturday doing my live streams. So please like my page, share it with your friends and family, and don't forget to go like my fan page, Dr. Lakeisha, OBGYN, on Facebook. Again, I am your board-certified obstetrician gynecologist, specializing in helping women who are struggling with life, sexual dysfunction, and self-image. Through my programs, I help women live purposeful, powerful, and passionate lives. Yes, Candy, an OBGYN can prescribe antidepressants if we are using them under the diagnosis of alternative therapy to hormone replacement therapy. Miss Wiggins, if you are 36 and if you had a hysterectomy but you still have your ovaries, you should not need hormone replacement therapy because the ovaries is where your hormones come from. So if you're not having any symptoms right now, I would not take any medications and I would continue living a wonderful life. Sometimes immediately after surgery, you do have a transient episode of hot flashes and you may seem like you're in menopause, but that should return to baseline about your 6 to 8 weeks out from your surgery. However, when you have a hysterectomy, just because you keep your ovaries, you still can have premature menopause or, premature ovarian failure. So again, it depends on your symptoms that you're having. And you want to have a candid conversation with your OBGYN. But if you kept your ovaries, you shouldn't need hormone replacement therapy at this time. Hey Patsy, thank you for liking my video and sharing it. Okay, ladies, so I need some more topics. I want to hear what you want to know. So next week we're going to do part 2 of menopause because I still want to talk about bleeding, sleep disturbances, anxiety, and the decreased libido. But after that, I have a few more topics that patients have recommended, but I want to hear from you. So if you have a topic that you love to hear me discuss on Saturday, please put it in the comments. Again, I know this is Saturday. It's a beautiful day outside here in Mississippi, and I know you could be doing a lot of other things. So I really appreciate you joining in with me today. I really appreciate you liking my Facebook and streams and sharing them. Please go and like my fan page so you can see what's coming up next. Hey, Kimberly Triplett, thank you for joining in today. Miss Rucker. Okay, what type of trouble do you think you're having? Okay, so if you're on birth control and they're not controlling your cycles, you may need an ultrasound. So really, it depends on the type of birth control you're having, but birth control is designed to regulate your cycles to make them shorter and more predictable. So if you're not responding to birth control, then I would say the next thing you need is a pelvic ultrasound to make sure you don't have something like fibroids or endometrial polyp, to make sure there's not something else going on. Candy, I have a wonderful friend in New Orleans who is an excellent OBGYN. She is my classmate from Xavier, and her name is Dr. Veronica Gillespie. She was engaged, so I'm not sure if she's gotten married yet, but you should be able to find her under Dr. Veronica Gillespie. Awesome friend, you'll love her. Any other questions? I am loving the feedback, guys. Keep the questions coming. I'm really enjoying sharing myself with you on Facebook. So I know it's Saturday and I know you have things to do. So thank you for joining me today. I will see you guys next Saturday. And you know who I am. I am Dr. Lakeisha, your board certified obstetrician gynecologist. Like my fan page and I will see you next week. Have a wonderful Saturday, guys.